Today I'm going to be showing how to insert a Foley catheter into a male. Before I go into the room, I'm going to check his medical records and make sure that the order is correct for the catheter, and I'm going to perform hand hygiene. Then I'll come into the room, I will introduce myself to the patient, I'll let him know about the procedure that I'm going to be performing, let him know that I'm going to be inserting the catheter. I will ask him about any allergies that he may have, such as iodine or latex, which in this case he's going to have an iodine allergy. After that, I'm going to raise the bed, lower the side rail, and prop his legs up, and he can also assist in that too if he can, in a position to where I have easy access. The next thing I'm going to do, I'm going to pull his gown back so that the area is exposed, and then I'm going to put on gloves so that I could first clean the area off. And I am going to clean the area off with a warm washcloth. You can use wipes as well, just making sure that they are warm for when they touch the skin. And so I'm just going to lift up. On the tip, I'm going to clean it in a circular motion and fold, and then on the shaft I'm going to be cleaning in a downwards motion. And once that's done, I can dispose of that in the garbage and remove my gloves. Next, I'm ready to insert the catheter. So I'm going to check my bag, my kit. It is unopened and it's not expired, so I will pull it out of the bag. And I'll set this right here. I'll open it up so it's opening away from me. And so all of this area is sterile now. And I'll take the sterile gloves out. So I can first insert those, or put those on. And I'm also making sure that I do not touch the inner part where the gloves are, or the gloves either. So I'm going to put those on. Okay, so once these are on, both of my hands are sterile, and I can get everything situated and set up. So the first thing I'm going to do is take this drape, and this drape is I'm going to place underneath the patient so that no fluid or urine gets onto the bed or anything else. So I'm going to make sure that I fold it like so that I'm not touching any part of the patient and my hands are kept sterile. And I'm going to place that under. Next, I will take this drape. I can just open this up. And the shiny side on both of them is always the one that goes down first. So I'll just put that in between his legs, kind of connecting areas. After that, I'm going to take the front of the kit, get everything kind of situated out of here. I am going to take the iodine, and I could throw this actually away because the patient is allergic. So I will take the hydrogen peroxide and dump it onto the cotton balls, because we will need those to sterilize. Then I will take the syringe. Again, this is kind of setting up so that I'm ready once the insertion happens. And I will attach that. Okay. Then I will take the lubricating jelly and I will put this on my tray. And once that's on the tray, then I will take the catheter and I will lubricate it about 2 to 3 inches. And I'll set that there. And before I insert it, I'm going to take the forceps with the cotton swabs, which do have hydrogen peroxide on them, and I will clean the area. I'm going to clean the area with my left hand, and so I'm going to hold the area with my left hand, so that will now be my unsterile hand. So I'm just going to clean in a circular motion around the tip, and then I can throw that away. Then take another one, and throw that away, and then take one more and get around the area, and I can throw that away. So I have my unclean hand, and I will take my clean hand now, and I will begin inserting. So I'll take this, and then I will lift up. I will let the patient know that he will feel a pressure, and I will insert it into the tip about 2 inches until I start to see fluid coming out. Once I do, I will then keep feeding it into the area. And if the patient does say anything about being in a lot of pain, I don't continue pushing the catheter in. So once I have the catheter all the way in, about where it should be, I'm going to take my hand and I'm going to fill up the balloon with the water from the syringe all the way. And once I fill it all the way, then I can detach the syringe. I could dispose of that. After that, I will then take the catheter and just tug on it a little bit so that I know that it's not going to come out because the balloon is filled. And then I will attach it to the patient's leg. We don't have the tape right now to do that, but that's what I would do if we did. After that is done, then I could dispose of all of my unsterile equipment into the garbage. I won't need this anymore. And I can take off my gloves. And then I can take bag, attach it, making sure that it is not above him. It has to be below so that I can drain. After I do that, well, I would have removed this also as well. But after I do that, then I will perform hand hygiene. I will cover up the patient with the gown. He can put his legs back down. I will raise up the side rails and lower the bed again. And that is it.